Hey everyone, welcome to Beyond. Be sure to hit like and subscribe so the algorithm can find the channel and share the content with others. Today we have a very special guest, Phil Gattone, who's the CEO and co-founder of Nourish. Hey Phil, welcome.
Hey, thanks for having me.
Yeah, man, so glad to have you on. And I was reading some of your backstory. Not only is it inspiring, but very impressive where you saw the need and you went to fill a need. So before we get there, um, take us back on your journey and what led to the formation of Nourish. Where'd that get started?
Yeah, so I was actually diagnosed with epilepsy when I was 4 years old. I had my first seizure in the middle of the night, and my my parents had no idea what was going on. They came into the room because my brother was crying, and they saw me convulsing on the floor. My eyes were rolling to the back of my head. I was turning blue. They thought I was dying.
Oh, wow.
So I was rushed to the hospital, and the seizure stopped over an hour later.
Wow. That's so, I mean, at 4 years of age, your parents must have been mortified. So when you went to the hospital, did they give you the diagnosis then, or did you have to go to a neurologist and kind of go through some workups to really verify what it is that you were experiencing?
Yeah, so it was actually it took a long time for my parents to find an actual doctor uh, that would work with them. So I wasn't diagnosed when I went to the hospital. They thought it was just going to be one seizure, but after that I started having lots more. At one point I was having over 300 a day.
That's hard to get one's brain around. I was reading some of the statistics in the US. About 1.2% of the population suffers from epilepsy, which is about 3,470,000 people. And so starting at four, you started getting the seizure experience. One can imagine that for you, that was the norm. I mean, as you're going through this process, that's what you woke up to past four every day with. Where would you say you found the strength and resolve to sort of fight through the brain surgeries, the thousands of seizures you've experienced? Where did that come from? Or is it just simply that this is my normal?
Yeah, no, I mean it was really tough growing up with it, and I mean it took a lot of work, but the thing that got me through it was my family and my friends. Um, they were there for me when I was struggling in school. They were there for me when I was struggling socially, and so I was lucky enough to build a support system and really just have a support system all around me that really encouraged me to keep working and really supported me when I needed them.
Yeah, and so as I was reading more about your backstory, you brought up a great critical point that you can get the therapy and treatment for epilepsy. They may be able to solve it through medicine. But what it sounds like is missing in the continuum of care is really that support group as you become an adult and you're experiencing this thing in this journey. And we know from cancer or other pathologies, other disease states, that if you have support, people tend to do better in those circumstances. So, talk us through that experience where you're going through the therapy as a young person. They're giving you meds, but at some point, where did you see that gap in terms of the support structure that really wasn't there for epilepsy?
Yeah, so what I found was just like you said, there were a lot of medical treatments. I was put on a bunch of different medications, but I wasn't really referred to a community. I wasn't referred to a support system where I could connect with others like me. I didn't know anyone else who had epilepsy for several years, and it was really hard because going through school, when you're younger like that, kids don't understand, and so they would make fun of me. They wouldn't let me sit next to them at the lunch table, and
Hmm.
it was really hard. So yeah, I mean, at least with my diagnosis, I wasn't referred to really any sort of social support group.
So take the audience back. If you have epilepsy, what does that look like when you're in high school or college, just to manage those number of seizures? Because I would think that the seizures are unpredictable, right? It's not like you can time them; they happen when they happen. So, kind of take us on that journey in high school. What was that like to manage epilepsy when you're in those formative years where friends really matter and being accepted is really important?
Yeah, I mean, again, it was really hard, and I mean, all I can say is to, just keep working through it, find a few friends that really support you, and you know, when you have a seizure, in public, it can be really hard, but really find a support system. And also, one thing that really got me through high school was finding a hobby. So I really got interested in computers. So whenever, I was struggling in school, I was always able to kind of go back to that hobby that I really liked. And it took my mind off of epilepsy.
Interesting, interesting. So as we move forward now, you saw this gap. You have epilepsy, you got the therapy, the treatment, but you really don't have the support structure, which I think was underscored through you going through this process as a young person. So what was the motivation to found Nourish, the company?
Yeah, so like I said, going through high school, I really kind of developed an interest in computers.
Hmm.
And so I decided to go to college, and I ended up graduating with a degree in electrical and computer engineering. So I graduated in 2009, and I've been working professionally for the past 10 years. And just recently, well, a few years ago, I decided to form a company that would help other people with epilepsy and would help them with the struggles that I went through.
So if you're talking to an investor, what is your elevator pitch of what is Nourish?
So I would say Nourish is a location-based software platform. So what we do is we've developed a software platform that lets us build applications that support patients and caregivers. So with this platform and these applications, we can help patients and caregivers connect with each other, also find a really good epilepsy specialist or an epileptologist, and we will connect them with information that is really valuable to them.
So I presume this is nationwide, and then eventually the rollout will be international. Or what is your focus as you're rolling this offering out?
Yeah, so we're just about to, or we're optimizing our applications right now, and we're going to start recruiting users from hospitals and local support groups. And so the idea is we'll grow locally in multiple parts of the country. And then as we grow locally in different parts, we'll slowly connect those groups together and cover the entire nation. And then once that's done, we can then move on to uh, globally, where we actually already have users from, I think, 4 different countries on our user base right now.
Oh, interesting. So let me go back and looking at your website, I noticed that you kind of had sort of three discrete applications. Can you walk the audience through each application? And if someone has epilepsy, what would they experience with each application that you developed?
Yeah, so the first one is epilepsyarticles.com. And this is basically a news aggregation system that we've developed that pulls articles and research from different sites on the internet, and it brings them into one central repository where users can connect and find the information they need to live a better life with epilepsy. So it contains epilepsy research, epilepsy awareness, it's professional articles in addition to blog posts. So that's epilepsyarticles.com. The second one is called epilepsydocs.com. And this is a really cool application because you log on to it and you're immediately connected to a map where it displays epilepsy specialists right in your own area. So you don't have to go to the Epilepsy Foundation or the American Epilepsy Society to search for different epilepsy doctors. You can come to epilepsydocs.com and you'll be able to browse, rate, and review epilepsy specialists all over the country in addition to where you live. So it's kind of like a Yelp system.
Yeah.
Uh, yeah. So then the last one, which is our most popular one, is also pretty cool. It's called friendswithepilepsy.com. And this is a social network for people impacted by epilepsy. So it's for patients and for caregivers, and really anyone who's interested in epilepsy can join. And what you do is when you join, you're able to create a profile with any information you want. It can be seizure type, you're diagnosed, whatever medications you're taking, whatever you feel comfortable sharing. And then once you create that profile, you're connected into our system and you're able to find other people just like you. So you can find other people who have tonic-clonic seizures, who are on Keppra, or who were diagnosed in the year 2001, let's say.
Hmm.
And so it's that epilepsy criteria also combined with your location information. So in addition to finding other people with the similar experience, you're also finding others that are local to you. So in addition to that, we provide a lot of other things. We provide a Zoom support group so users can connect, and basically it's just basically like a support group, but in the comfort of your own home. We provide a place where users can ask questions and share their stories, and then connect and share advice and any information you want to share, you can.
That's nice. So, is there active research going on with epilepsy, active clinical studies, active development of new drugs or new therapies that you're aware of?
Yeah, there are. I mean, there's a lot of stuff going on right now. I know one of kind of the newer treatments is called the RNS,
Hmm.
which is I mean, I'm not a doctor, so I can't, this is just from my perspective, but it's like a chip that kind of goes on the surface of your brain and it records your brain activity and seizure activity.
Hmm.
And then you can use that, you can upload that data from that chip into the computer and then send it to your doctor where they can analyze it and determine what type of medication is good for you, and just kind of help improve your treatment through that data.
So, have you found in your experience with epilepsy that environment, diet, those sorts of things influence the level of epilepsy, or is it independent to diet, and environmental factors?
Yeah, I mean, the thing with epilepsy is uh, it's there's a broad range of um, kind of severity,
Hmm.
and it's kind of different for everyone. So there are people who are having lots of seizures, who are really struggling to kind of live day to day, and then there are people who have epilepsy but they haven't had a seizure in a long time, and they're driving and they're able to kind of live their own life and go to work. And so there's a big kind of range, but there are a few factors that are kind of common throughout the whole range. One being stress. If you're under stress, that can trigger a seizure. Another really big one is lack of sleep. So if you're not getting a good night's sleep, that can really kind of lower your tolerance for a seizure. And so those are really kind of the two main things. So if you try to get enough sleep, if you try to relieve stress by working out, relaxing, meditating, whatever, that can help. And then all that stuff in addition to the typical medication and diet can help.
So, given that epilepsy is sort of a spectrum disorder, how effective are the drugs that are used to treat it, would you say? I know you're not a doctor, but you probably have experience it. You've talked to people. How effective do they tend to be?
Yeah, I mean it's really kind of, again, based off of the individual. So there are medications that will work really well for someone, and then you could put someone else on those same medications and it could not work at all. So, and with the medications, there's always a balance between seizure control and side effects. So some of the some of the medications really kind of control seizures, but then have really bad side effects. So it's
Mm,
almost not worth it because the side
mhm.
effects could be worse than the seizures.
Right.
Um, so there's that, and then if there are quite a few different medications, and so doctors will try a bunch of different combinations to see what works, and then if medication doesn't work, you really kind of the only other option could possibly be brain surgery. But even not everyone's a candidate for brain surgery. You have to the seizures have to be coming from one part in your brain.
Right. Have you found that, and again, I haven't researched a lot, with epilepsy, is it something that starts at age 4, or can you develop it when you're 40, 50?
Yeah, so you can develop epilepsy at any age. The majority of cases are developed or diagnosed when you're younger and then when you're older. So lots of people will have like one seizure throughout their life, but that's not considered epilepsy. That's just having a seizure. But so the majority are younger people and older people.
So do they classify chronic and acute epilepsy, or I'm sorry, chronic and episodic, where episodic is maybe, maybe it's 5 times a year, and then chronic is multiple times in a month?
Yeah, I think I'm not sure, but there's intractable epilepsy where the person's having lots of seizures and isn't a candidate for surgery and medications aren't working and it's really bad. So you try your best to keep living and do what you can. And then there's like you said, there's the type of epilepsy where someone might have a seizure once a year or once a month and they're able to live their life like pretty much normally.
Yeah. Have you guys thought in terms of your offering? I know you got the 3 apps to connect the different groups. Have you guys ever thought about using AI, machine learning, as you're getting this incredible database of people across the country based on the date the epileptic seizure started, their age, their ethnicity, height, weight, body surface area, all those factors? Are they smokers? Are they non-smokers? Are there comorbidities?
Hmm.
Have you guys looked at maybe a database and then applying AI to that to start making some correlations?
No, yeah, we've looked at that a lot, and there we have been looking at a few options that will will give not it won't recommend treatments, but it will give like kind of possible treatment options to users based off of what other users are experiencing. Um, and and then users can use that information to bring to their doctor, which then the doctor can use, and they can discuss if that works or what. But I mean, what we're doing is using AI to just kind of um, provide insights into our data.
No, that's really important. I think there's a lot of value. In fact, for the company, I'd argue that that becomes a pretty significant value point. And so, as you think about the ability to communicate in this platform using AI, I think it's pretty important. The idea of trying to sift through the data and what it's telling you. Have you thought about maybe an app that people that suffer from epilepsy could put on their phones as part of Nourish? They can connect to the community and also provide data that way. Because I know on the migraine side, they have a lot of migraine apps. So you can sort of record the events, because every 3 months you go back to your neurologist to share the journey and if the meds are working or not. But it'd be interesting with an app to be able to sort of collect that data, maybe when they're taking their meds, the frequency, when they had an epileptic seizure, be able to record that. Now, the trick is always obviously getting them to do that consistently. But I think that there's that community. and mechanical to people through Nourish, I think that could be pretty motivating.
Yeah, no, definitely. And there are actually several apps out there that will do that and let you record your seizure and actually, let you record the seizure. If you're a caregiver, you can use your phone to record the video of the seizure, and you can collect data that way. But so one of the other things that Nourish is doing that's a little bit different is instead of trying to redevelop applications that already exist and trying to compete with other ones that are out there, we're looking to partner with other organizations and help them develop their product and connect their product to our community, while they're also connecting the Nourish brand to whatever they're offering, whether it's an app or a service.
Right, that makes a lot of sense. So, as far as, by the way, how long has Nourish been around? When did you guys incorporate?
So we incorporated in 2015, but we had kind of um, stopped working on it a little bit, but then because originally Nourish was meant to be a social network,
Hmm.
just a social network. But what we ended up realizing is we started to add these different things into the social network, and it started to be too big. So that's when we pivoted to a platform which allows us to develop multiple applications instead of just one big one. So
Right.
yeah, so we were incorporated in 2015, and we pivoted to where we are now.
So, how have you guys received funding today?
So we've received funding from NeuroLaunch, which is the first accelerator we got into, which was in 2015. And they gave us a little bit of seed funding, which we used to go through the accelerator and connect with investors and mentors and start to develop our product. And then about a year later, we connected with Synovian Pharmaceuticals, who gave us some more money to develop the MVP, which we did. And since then, we've been kind of bootstrapping it, and it's being self-funded for now.
So, with Synovian coming in, I presume that they help you with some at some level with the proof of concept. And I also read that you guys are currently in the seed round of funding for the next tranche. How has the Synovian investment aided in the next round of funding for you guys?
Yeah, well, I mean, they helped us get to the point where we were able to have an MVP, and then from that MVP, we were able to actually get into a new accelerator, which is called New Chip.
Okay. What are you guys looking to raise in this round?
Right now, we're looking to raise 800,000, and that'll help us. Um, it'll help us optimize our applications, hire new developers and staff, and then a lot of it will be put towards marketing and acquiring users, because uh, our value comes from our user base. So the more users we have, the more people we have using the platforms, the more value we're able to have. And so that's why a lot of it will be going towards user acquisition and marketing, and connecting with other organizations, like I mentioned previously.
Is the part of your website that creates the most stiction and trackiness or stickiness the part where you're connecting other epileptic patients with peers that are in a similar circumstance?
Yeah, that's definitely the most popular one right now. Friends with Epilepsy is it's it's fairly active, and users are connecting with each other and posting questions. So yeah, that's the most popular one right now.
So in this seed round, are you guys raising the funds via convertible note or is it an equity round for you?
We're accepting, we're raising through convertible notes and safe notes.
Okay. And then when you get the 100,000, does that take you to profitability, or do you require another Series C, let's call it two, to continue moving forward?
No, we feel that if we're able to receive the funding in this round, we'll be able to optimize our applications and then make the additional hires and changes in marketing that we need. And that'll get us to a point of significant revenue where we would be able to pretty much be sustainable on our own.
And so if you looked at your cash flow model and business plan, what does the revenue look like 5 years out if someone were to invest in this opportunity?
Yeah, so our business model mainly revolves around clinical trials and patient-reported outcomes. So we're able to, as we build our user base, we would be able to provide users for clinical trials to pharma companies, and then also uh, as far as patient-reported outcomes, we would be able to help track the journey of the patient and view kind of the um, health and economic output reports, help develop those, and provide kind of the anonymized information to help improve the therapies that are out there.
Right. And is there any opportunity, since there's a social networking aspect of this, software as a service to the epileptic patients, or pharmaceutical companies that are in this space that provide drugs for this condition? Are there opportunities from a revenue standpoint to get ad revenue?
Yes, definitely, and that's another revenue stream is through sponsorship on the applications. And then in addition to sponsoring the application, we would also be developing applications for other organizations. They would just be part of the Nourish family. So we would have multiple applications, but they would all be branded from the Nourish platform.
Nice. So in this application, when you think about software as a service, what part of that is IPable? Is any of it IPable? Is any of it unique, or is it simply first mover advantage, first to market, has market share they've captured? Is there any way to protect your IP or your intellectual property?
Yeah, well, our platform is really what's valuable to us. So what's different about our platform is instead of replicating a single application, just kind of basically copying and paste it and kind of replicating the same functions. What we're doing is we have a common platform that has different services associated with it. And within those services are functions which we can reuse all these functions to create different applications. It's not just simple copy and paste. It's more agile, which allows us to scale quickly and develop new applications really quickly.
That's a big advantage. In medical devices, if you have a device that does something specific, to get a new market, you have to create the device for that market, for that unmet need. In this case, you can simply take the same platform, maybe a little bit of the analytics part of it, and apply it to new applications. So having said that, what are some additional pathologies you guys are thinking about targeting beyond epilepsy?
Yeah, so as part of the Nourish platform, like I said, how there are different services. We have the epilepsy service, which lets us develop the epilepsy applications. But one of the new services that we're looking to integrate is a Parkinson's service, which will allow us to create Parkinson's applications, or an MS service, which would allow us to create MS applications.
Are you going? So it's funny. I have a device that we're focused on strokes right now, but it's a non-invasive device that can detect migraines, Parkinson's, dementia, Alzheimer's, to name a few. And actually actively working with neurologists. So it's interesting that you have these platforms because I think there's a big need and big gap in the care these people receive, and in between the doctor's visits. It's like a no man's land. I mean, if you got a migraine, you see him maybe every 3 months or her every 3 months to get Botox injections or a change in your meds. And in between that time, it's utterly a nightmare. And so the idea that you have a platform that can connect people, that could add some real concrete value. And I'd also argue the idea that you could, with this data, maybe get some retrospective studies, right? Because if you have a database, you can go in there and start querying different attributes or variables, based on whatever you're trying to study. And to me, that's highly valuable because I've not heard of anything that's brought this together for those pathologies. I think people just go out there and it's a one-off, and the doctors are trying to remember, this patient and their situation and sort of look at the continuum of care that they've given these people. But it's not really with the insights that AI can provide or all that you're going to ultimately have in your database.
Right. And that's another thing that is a little bit different about us is um, we're a platform and that allows us to integrate with other different diseases. So that means we're able to aggregate all the data from the different diseases and then kind of cross-reference that with other diseases. So we would be able to provide insights into Parkinson's, like how Parkinson's is integrated, how Parkinson's affects epilepsy, or how epilepsy affects MS. And so there's, like you said, there's really nothing out there that does that. And so what we're looking to do is kind of create a standard of social support applications across all diseases and chronic disorders.
No, that makes a lot of sense. Have you guys ever approached the NIH for NIH funding?
No, we haven't.
Yeah, I mean, in one of my businesses, we've done that, and I think this would probably be an interesting space for them. I mean, the idea, they're all about how do you get more effective care at a much cheaper cost. And the second thing they're really interested in is keeping people from the hospitals or the clinics that really don't need to be there. So the more that you have predictive analytics or some smarts behind the platform that helps guide and direct people at some level, they're all for. That could be interesting. I think they're right in your backyard there, if I'm not mistaken.
Yeah, yeah. We're located in DC, and so yeah, that's definitely something I'll take a look at.
Yeah, we're looking at a grant up to 250,000 that can go up from there, and they're just popping up all the time. You got to go through a process and get a writer, but we're pretty bullish on it. So yeah. So is there anything we've covered that you would like to cover? Anything we haven't covered that you like to cover?
Um, I think one thing I want to mention that is a little bit, again, that's like a little bit different from other applications that we're kind of competing with is there are a few other applications that provide support to people with epilepsy, but we're different in how we're branding ourselves because unlike other applications where they kind of portray users as being really sick and needing help and needing advice, we're kind of the opposite of that. So we don't view it as kind of you're sick and oh we're sorry. We're looking at it as empowerment. So we think when you're diagnosed, you know, we aim to empower you. We aim to empower you, and you're not broken. You're perfect, and we want to enhance that.
No, that's important. I think it's all about mindset and how you view something, right? And I think that's an excellent way to do it because it is what it is. I mean, epilepsy, you have it, you got to manage, you got to deal with it. So why not take it on in a positive fashion? And what you guys are doing is really providing a lot of great information and probably at the end of the day, a lot of confidence in their journey. And certainly getting connected to other like-minded people that are going through the same journey is completely huge from a mental health standpoint, I would think.
Yeah, exactly.
I haven't studied it, but it would seem like it would be pretty obvious. So, where can an investor or a patient go to learn more about Nourish?
Yeah, so you can actually email me directly at phil.gattone@nourish.me. So that's neurish.me. And I can give you some more information and provide you with whatever you're looking for.
Fantastic, Phil. Hey, Phil, thanks so much for coming on Beyond and sharing your journey, your story, and the great work you're doing at Nourish.
Yeah, of course. Thanks for having me.
All right, take care.